Hi everyone, welcome. It's nice to see you all. I see lots of names that I recognize, so it's nice to see you. So today I will be talking about some general tips and advice on medical school secondaries. For those of you who don't know me, I'm Kristen Zukoski. I'm one of the pre-med advisors here on campus. And with me today is Elena. Elena, you want to introduce yourself?
Sure. Good afternoon, everyone. My name is Elena Hernandez Ramon. I'm the director of the pre-medical program at the Office of Intramural Training and Education.
Great, thanks, Elena. So Elena will be here, so you might hear her voice also. So let's go ahead and get started because I have a lot of information to share with you all today. And I will be answering some questions at the end, but just keep in mind that I'm only really giving general advice, and we aren't going to be answering questions that are specific to your situation, just so you're aware of that. So my outline today is to give you some general advice. Then I'm going to give you some advice on some different question types that typically pop up on secondaries. So things like diversity questions, why us, adversity challenge questions, the COVID-19 questions, and then some next steps. So first, some general tips. As you're thinking about the secondaries and how you're going to fill them out, I would definitely recommend that you start pre-writing some of your answers now and or as soon as you submit your AMCAS. You can use questions. Many schools don't change their questions from year to year, so take a look and find out what the questions were last year and start working on them, because it is really important that you complete those secondaries and resubmit them as soon as possible. So by as soon as possible, I mean really within a couple of days, maximum 2 weeks, although we really don't want you to sacrifice the quality of those secondaries. So make sure you're doing them well and taking your time, but doing them in a very timely fashion. Schools really do track that. And as you're thinking about the priority of which ones you are going to submit first, really think carefully about that. So some students want to submit their dream schools, let's say within 2 or 3 days, and then they wait on the schools that are more likely or their in-state schools for too long. And so I would recommend that you think carefully about the priority of these schools and which ones you are going to put back in first. Also, make sure you're really checking your email and your spam folders because you're going to be getting a lot of emails. And so what we know is some students say, oh, I didn't even see that secondary. It was sitting in my spam folder. I didn't see it until it was already a couple of days. And then you're really putting yourself at a disadvantage as this process goes on further. So some things to think about. On top of that, on top of general tips, I also want to give you some general tips about the content of these secondaries. So medical schools are looking to see you highlight your core competencies. So I would encourage you to go back to this document that's on the AAMC site and take a look at that list of 15 core competencies and make sure that you are highlighting those things throughout your secondaries. So one way to think about this is that the secondaries are really a chance for you to help schools to understand how you fit within that medical school. So you can do this by emphasizing the aspects of your experience that best illustrate how your values and your passions really align with those individual schools. You can use some of the same experiences. So just like we say with the personal statement, just like we say with other essays, there can be some overlap. If there's an experience that's one of your most meaningful, if it makes sense to include that experience again, you could, but I really wouldn't tell the same story. So I would think about ways you could use that experience, tell a slightly different story, a different experience, to really make sure you are answering those questions. So Dr. Bill Higgins, who works with us, what he says is to make sure you include the minimum characters about what you did and the maximum characters really about what you learned, how you became a better person, and how you will be a really fantastic future physician. The next thing is make sure you're answering the question, okay? So a lot of these questions are really long. They have multiple pieces, multiple parts. The schools write them like that for a reason. So make sure you are truly answering each of those questions. So you might see there are some overlap. So even as I get ready to talk about diversity questions and challenge questions, some of them are written slightly differently, or they want you to write from a slightly different perspective or slightly different angle. So make sure you're really not just cutting and pasting, and I'll talk about that a little bit more later. Make sure that you are indeed answering the question that they are asking. Make sure also that you're doing your research and giving specific examples that match those individual schools. Try not to be so generic, but try to really touch on how the things that that school offers really fit with who you are and your past experiences, and really who you want to be as a physician later, and why that school is a really good match for you. Okay, so let's talk a little bit about diversity questions. So these could be written in a variety of different ways. The first question that I have listed here is from The Ohio State University, and we just heard from one of the Associate Director of Admissions yesterday, and this is actually their question that is for this cycle. It's on their website already, and so for your list of schools, make sure you're going to the websites and those that are published. Go ahead and start answering those questions if they're there. So this question is really that the admissions committee will assemble a class that displays diversity in background and thought. Why is diversity in background and thought a desirable characteristic for medical school's student body? And you only have 250 words or less, so these are very short. And so again, put yourself in the situation where you want to go to that school. And so how can you be a good fit? What will you bring? What unique characteristics will you bring? And really think of diversity very broadly. Also, there's another medical school. This is just one that I found. How will your background and experiences contribute to this important focus of our institution and inform your future role as a physician? So again, a similar question, but worded slightly differently. A third example, and this one is a longer one. This has a lot of different pieces, and so make sure you are really, again, answering the question. The admissions committee regards the diversity of an entering class as an important factor. So I'll let you look through these, but it gives you a list of all of the types of things that they're looking for in regards to diversity for this school. And then the last sentence is also what is really important. Please discuss how such factors have influenced your goals and your preparation for a career in medicine. So this is a image that I found, and it just gives you another way of thinking about really the broad nature of diversity. So often we think of gender, race, ethnicity, sexual orientation, age, and physical abilities or qualities, so those middle circles, but I would really like you to think about diversity much more broadly. So this could be in your communication styles, in your specialties, and your experiences, your socioeconomic status, your geographic location, your education, all of these things you should think about when you're considering the diversity questions for medical schools in your secondaries. Okay, and one of the things that they're looking for is for you to be demonstrating your cultural competency. This is something that you'll be talking about a lot in medical school. And what they mean by that is that healthcare services need to be respectful of and responsive to the health beliefs, practices, cultural and linguistic needs of diverse patients. And these can all lead to positive health outcomes for patients. So they want you to show that you've had some experience demonstrating these qualities. And so to show this, be thinking of experiences you've had and how did you feel in those opportunities? Were you in a hospital? Were you in a free clinic? What types of volunteer experiences have you had that can demonstrate your cultural competency? What qualities did you demonstrate in those experiences, and how will those help you? How have you developed them, and how will they help you as you move on to medical school? What are the types of things that you learned about people, about physicians, about our healthcare system? What do you have yet to learn? And so really being thoughtful about your answers and the pieces and the gaps that you still have in your knowledge. I wouldn't highlight that too much, but I would really be thoughtful about the things that you know you would like to learn while you are in medical school, and maybe what you're doing right now to help you gain those skills. How do you plan to apply these lessons throughout medical school and really your career? So as you're answering these questions, again, focusing less on the setup and the experience and more really on your explanation of those experiences and how you're moving forward. Okay, the next type of question that I want to talk about is really the questions that are why us. Again, these can be asked in a variety of different ways. So this is another example from the Ohio State University College of Medicine, and their mission is to improve people's lives through innovation and research, medical education, and patient care. Please describe how your past experiences predict your potential to contribute in 2 of these 3 areas. Again, 250 words or less. These are very short. So some tips when you are answering these questions: don't use the weather or location or those general things, even though we tell you that it's really important to think about those things as you are applying. And it's going to be useful as you're interviewing at those schools. So when we do mock interviews, we'll walk you through how to answer these types of questions, but being really specific and talking about how you fit. And then medical schools really understand and want you to speak to the location at the end, because they really understand that a support network is really important for your success in medical school. And so if you have family there, if there's a reason you want to go to that school, you can say that in your interview, absolutely, but I wouldn't use that for this as a secondary. I would focus on other things. Make sure that you're not just restating the mission statement, the programs, the resources, or the offerings. They know what they offer. So you can highlight unique aspects of their curriculum, specific programs, their research availabilities, and their hospital affiliations. But it's better if you're really focusing on what makes you a good fit for those things. So instead of just saying, I like that you have this, I want to do this, you have a great this program, instead focusing on how your experiences and interests really fit the school. I really look forward to participating in this really particular program, or I already have some research experiences from the NIH or elsewhere, and I really like that you have a track that focuses on that. Or, you know, the number of schools who take a year off for research between their 2nd and 3rd year, those types of things that really bring you into a 3D shape, and to really have them see what you can bring to the school. And then on top of that, what do they offer that could be most beneficial to your future career goals? So if you already know you want to do a specific specialty, you know that you want to do primary care, and they have lots of students who end up going to a primary care role, say those things. If there are particular tracks and programs that are going to be beneficial to you in your career goals, make sure you're going to say that. The other thing to consider is contacting current students and or alums of the program. This is a really great way to find out information that isn't listed on their website, and gives you a chance to ask those students if you will really be a good fit for that school, and some additional things that you can say in these essays. So I would encourage you to do that, especially if you're home, if you're not going to lab, if you have some additional time. If your AMCAS is already submitted, these are some types of things you could think about doing. The next type of question I want to highlight is these adversity or challenge questions. Again, these could be written in a variety of different ways, so make sure you're answering their particular question. But this one is, the admissions committee is interested in gaining more insight into you as a person. Please describe a significant personal challenge you have faced, one which you feel has helped to shape you as a person. So sometimes students say, I don't have this giant challenge, or I don't have this huge adversity in my background that I've overcome. That's okay. It's less important the situation that you choose. It is more important for you to talk about this second part, which is how you got through the experience and what you learned about yourself as a result. This one here, it says limit your response to 1 page and leave a blank line in between paragraphs. Make sure you are following all of those specific instructions when you are filling out your secondaries. So some more specific tips about this type of question. Like I said, the topic, the situation is less important than showing what you did after. So how did you deal with that situation and what did you learn? So I always tell students to make sure you are in the active voice. What action steps did you take? How did you reflect? How did you grow from that experience? If it was challenging to you to, let's say, when you came to lab, the public speaking aspect was difficult, what did you do to help with that? Who did you reach out to? Did you go to seminars? Did you go to workshops? Did you volunteer to present at lab meetings? Did you join journal clubs? One example of things that you could do to answer this question. And I tell students too, using resources and asking for help is not a sign of weakness. It's really a sign of strength. And so if there were people that you reached out to, again, that's a nice way to show how you will respond to stress, how you will manage your stress once you get to medical school. And so thinking about in your reflections, highlighting those qualities that you have and those things that you've already tested out and those systems that have worked for you in the past. Okay, the next type of question I want to talk about is COVID-19 questions. So the one that I have listed here is from ACOMAS, and this is the one that is actually on their primary application. AMC decided not to put one on the primary for the AMCAS, but just so you can get a sense of what you might see, this is the one for OD schools. And so it wants to know how COVID-19 has impacted your pathway to medical school, and items to consider incorporate all 3 of these different areas. So you could be talking about academics. Were you able to interact with your professors? Some, not at all, just a little bit. Did you have to leave an academic program, stateside or abroad? Did your school require you to move to pass-fail grading systems? Did your MCAT get canceled, delayed? Did it get canceled or delayed several times? And were there any other academic barriers for you during this time? The second category is professional. Did you hold a job? Did you have to go and get a job because your job was canceled, or a parent maybe lost a job and so you needed to support your family? Did you lose a job? Are there other financial or professional barriers that you faced during this time? And this could be different for each one of us, as well as the personal impacts. Did you have to move out of a dorm? Did you have to change plans? Did you seek out volunteer opportunities that arose from the crisis? Did you assist any family or community members that were affected? So as you're thinking about each of these 3 different categories, be thinking about all of the ways you've been affected during this time and make sure you're highlighting those for the committee. Some tips here though, don't make excuses. They're not looking for excuses. Oh, I had planned on doing all of my shadowing in the last 4 months. All of my shadowing got canceled and so I wasn't able to shadow. Blaming the system, blaming the pandemic, complaining about the types of things that you are having to deal with really isn't what they're looking for. They're really looking for how you use this as an opportunity to grow and change and impact your community and our healthcare system. So think about how you chose to spend your time. Were you able to volunteer? Were you able to virtually volunteer? What classes did you take? I know some students are really taking advantage. For those who are on campus of some FAS courses, some certificate courses, blogs, podcasts. What did you participate in? How did you fill your time during this experience? And again, how did it affect you personally? So I know even in our office in the OIT, lots of different people, this is really affecting different people in different ways based on your home situation, based on lots of other factors. And so this is not going to be the same for anyone. The other things they're really going to be looking for is, what did you learn about medicine and our healthcare system? What have you read? What do we know about health disparities with COVID and other things? And did your perspective of medicine change at all? Have you started thinking about things in a slightly different way? Has it changed your course of action or the types of programs that you're really interested in and what you want to do in your future? Okay, some other types of questions that you may encounter on your secondaries. This one is a research essay. And so for those of you who are applying to MD only programs, we told you, right, when you were writing your personal comments, to be focusing on the big picture, the patient outcomes in your personal comments. For these schools, and some schools have a big research focus, and that might be one of the reasons that you're applying to those schools. So here is an opportunity for you to really talk more about your research, the hypothesis, the methods, the results and interpretation, and the application of your work to the medical field. And then again, make sure you're answering the full question. So in addition, please briefly share your motivation for pursuing this research project and reflect on how this experience affected you. Again, they're interested in your reflection. If you have not participated in research or scholarly work, please indicate so in the text area below. So many students do have some research experience, and so make sure you're talking specifically about your project and the results and applications of that. Just some other examples of types of questions. If you're working on a small group project and you thought another student wasn't carrying his or her load, how would you handle it? So again, they're looking for these type behavioral questions. How have you handled these situations in the past, and how are you going to handle those experiences when you enter their medical class? What are the types of things that you are going to do? What skills do you have? What communication skills do you have? What feedback skills do you have? What other OITE workshops have you participated in that can help you think through these things? Have you done workplace dynamics? Do you have an idea of how to work through conflict and teamwork and these other things that are really so important throughout the rest of your career journey in lab, but also elsewhere as you are moving into the future? Describe your exposure to medicine. This is a really broad question. You don't have a lot of time, but be thinking about how you can really show them what you have done and what experiences you've had. What do you think you will like best about being a physician? What do you think you will like least about being a physician? These are ways for the schools to get a sense of how much you know about being a physician, how well you're able to really self-reflect, and how well you have really confirmed that you know what a physician does and you know that you will be successful in medical school and beyond. Describe yourself and your medical career as you see it 10 years from now. I like this question. It's a really interesting question to me. Thinking about if you have an idea of the specialty that you want. If you don't, that's okay. How are you going to explore that? What ideas do you have? What kind of impact do you want to have in the next 10 years? Where do you think you will be? Okay, now I just want to comment about the actual, well, maybe I'll go back. Now I've already shared this slide, but Elena, are there any questions at this point about specific questions that I should answer?
There are a couple of questions that I think are worth it to answer verbally, but I think we can leave them to the end.
Okay, great, thank you. All right, so a word about the process. So you all know you're going to submit your AMCAS. Some of you maybe have already done that. The first transmission date is going to be July the 10th. That's when those are going to be sent to medical schools. Be aware that some of the schools are going to send your secondaries without that verification. So let's say you don't submit until after July 10th. Let's say you submit July 11th. So you haven't officially been verified yet. Some schools still might send you secondaries at that point without yet being verified. Some are going to wait till you're verified. Some are just, they send them to everyone. So be aware of that in your timeline. And as you're thinking about when you're getting ready to take the MCAT, if you haven't already taken the MCAT, and how you're going to think about starting to pre-write these things, because many schools are just going to send them to you. Most schools are going to send those secondaries, like I said, without pre-screening. Some are going to wait till you're verified, some aren't, but the majority of schools send secondaries to everyone who applies. Some schools have minimum requirements, and in some cases, those are listed on the school's websites. And so take a look. So I was looking at some today that have some minimum MCAT, some minimum GPA requirements. And so long as you fit those minimums, you're going to get a secondary. So be prepared to be writing a lot of secondaries. Then there are schools that screen applicants first. And so this is not an exhaustive list of schools. This was in a quick glance this morning, but this list here is schools that are going to screen your application before they're going to send you a secondary. The thing also to note about your MCAT score, and Elaine and I have been attending a conference this week for pre-health advisors, is that not all schools are going to wait for that MCAT score. So what we heard is that many are going to still send you secondaries, especially those who send secondaries to everyone, but some schools are going to start screening your application even without that score. They're going to be looking for that future date that you're listing on your AMCAS, but they're still going to be sending you secondaries. Okay, so some next steps. So as I said, make sure that you are pre-writing questions based on previous years. So take a look at your list of schools and see what you can find about the types of secondaries they typically send to students. My guess is that they aren't going to change too much, with the exception of, I would say in many cases, adding a question about the current situation that we're in the pandemic and COVID, but that could be written a variety of different ways. So I don't yet know exactly what those are going to look at. So use the ACOMAS one as an example for you. Make sure you're checking your email and submitting as soon as possible. Within a couple of days, maybe up to 2 weeks if that's necessary, especially if you get many secondaries all at the same time, which is very possible. Make sure you're prioritizing these things. Have a conversation with your PI, have a conversation with your mentors, just so they are aware of which stage in the process you are in as you go throughout medical school, so that they know. Be prepared to receive secondaries even if you haven't taken the MCAT, as I said. And the last thing really is, due to the number of students, our office doesn't review or critique secondaries. We don't look at your individual situation. We don't read those. We just don't really have the bandwidth, unfortunately, due to the number of students. That's why we're hosting this session today, to hopefully give you some general tips and to get you started in writing those secondaries. So I'm going to answer, again, general questions today, but I'm not going to be answering any questions about your particular situation or a particular school or a particular question. Some upcoming events for you to consider attending, again, as we continue this process. Interviewing for medical school, Alina is going to do on July 14th. The graduate and professional fair is in August. I would encourage you to come to that. Lots of representatives from medical schools will be there. We're going to have some panel discussions. We're going to have some workshops. And so our registration is already open on our website for that fair. And so I would encourage you to go ahead and register for that so you're aware of the schedule and the topics. We're also, just like we did for Career Symposium, going to have quite a few videos that are up that will go live that week, but that you'll be able to watch at your convenience. Also, so you won't be missing concurrent sessions. The end of the summer into the fall, our office, we haven't exactly nailed down exactly how we're going to do this, but more than likely it's going to be completely virtual. We will be doing mock interviews for medical school, for graduate school, as we have done in prior years. So take a look at that. And be aware, read your emails carefully when you get them. We do sessions for MD only candidates and MD PhD candidates, and because we do those a little bit differently. And so make sure you are signing up for the correct slot. All right, that is all I have. We have some resources on our website. All of the talks that we have been giving this summer in our office, they're available, they're recorded. Many of them are being put up in the OITE YouTube channel. And so if there's something that you've missed, I would encourage you to take a look at those, choosing and applying to medical school, some other things. And this is the way you can make an appointment with a pre-med advisor if you are at NIH on campus. So with that, I will go ahead and take questions. I see many questions in here. Elena, are there some you want me to start with?
Yes, I've been trying to answer them in the chat box, but some of them require a longer application. So explanation, sorry. So if I can direct you to the number 1, 2, 3, 4, or I can read it for you. This is about uniqueness. How would you recommend brainstorming about the question, what makes you unique? I think that's a very good question. And what would you recommend that we include or not include in that response?
Yeah, wow, this is a really great question. Yeah, and so I think I would direct you back to the slide that I showed about all of the different diversity things ways in which you can be diverse and unique, and thinking about your prior experiences. So some ideas could be, print something like that. Brainstorm, really think of all of the things that make you you. You could also think about talking to people who know you well, asking them the same question. Other students who you know, maybe you have some friends who have already gone off to medical school, you could have that conversation with them. And as far as what not to include in those responses, it's also a really great question. Elena and I actually had a conversation about this morning. And so I would say there are some topics that are slightly riskier, although depending on your situation, depending on the school, it could be still appropriate to include those things in a general way. So things like religious affiliation, maybe you don't need to be so specific, but if that is something that is really important to you, that makes you you, maybe that's a place where you've gotten a lot of your volunteer experience or your time, then you could think about including those things as well. Elena, is there anything you want to add to that?
The only thing I would add is that some people think that they're not unique because they didn't have this huge challenge, and I can assure you that everyone is unique. So dig in, reflect, brainstorm, talk to friends, talk to advisors. I am completely sure you can show something that is unique.
Yes, definitely.
Great. So I have another question here that I think is better to respond verbally. Sorry, I just lost it. Give me 1 second here.
When talking about diversity,
Yes.
adversity, that one? So the question is, when talking about diversity, adversity, related to being a minority, how do we talk about these things positively without perpetuating the pull yourself up by your bootstraps type of rhetoric? I think that's a really nice way of putting it. The way you said, which is talking about it in a positive way and the things that you've learned from your experiences, and the skills that you've gained and your resilience and what you did, what action steps you took, who did you reach out to, what is your support network, what mentors do you have, what this goes back again to that unique question, how does it make you you? So anything you want to add to that, Elena?
Sure. Yes, I was going to say, as part of a minority group, I can tell you that sometimes it's just easy to go to the negative thoughts. And you are saying here, finishing and having the positive perspective. So one thing that I find very important as a person from a minority group is when you learn about others, when you can be beyond your adversity and just realize and grow and become a much more culturally competent applicant, and say how you can be a much better physician, not because you are only part of a minority group, because that has helped you understand others, other situations, right? And then you can connect better with your patients and you can be a more efficient physician. So that is one of the things I think you can include. And then, so I know that you don't want that rhetoric, apparently, without perpetuating. I know, I would say, still you need to let them know how you overcame those situations, right? So make sure that you mention that. And then the last thing I wanted to mention is, I don't know if you were able to see the upstander bystander workshop we had. What actions have you taken, especially from minority populations? We may receive microaggressions regularly, and how have you responded? How have you responded for others, right? So I think you can see these from different angles, and you don't need to be repetitive. You're going to have your own story about that.
Yeah, absolutely. I mean, I'm glad, Elena, that you brought up that upstander bystander training too. For those of you who haven't watched that, it's up. I would encourage you all to do so. I think it's really helpful. So whether you come from, a minority or a dominant culture or group, I think it would be really helpful as you're thinking about these questions to have some of that language in how you can be an upstander, how you can be a leader, or if you're not a leader, how you can still make change in your current situation. And so as you're going through this process, as you're getting ready to go to interviews, for those of you who are going to have MMIs, there are going to be lots of scenarios. And so ways that you can think about all of those different things would be really helpful. So there is a question about optional questions and whether you should answer them. If you have something to say, I think absolutely. You don't have a lot of space in secondaries to really show who you are and how you would be a really great fit for that school. And so I think in most cases, I mean, you don't need to fill it out if definitely the answer is no. Or for example, the research question, if you haven't done research, then that's all you're going to say. But really, this is your opportunity to showcase who you are and what makes you unique. And so I would encourage you to think about that and all of the different ways that you could do that.
So there is another question that looks very interesting. I can read it for you.
Okay.
How personal can you get about adversity challenge essays if you have grown the most from personal challenges?
Oh, that's a great question. And so I think there is a fine line between personal and too personal. So definitely a personal question, but just be careful of some topics. You don't want any red flags in your application. And so if it's something personal, let's say like a mental health challenge, or you took time off from school, I would really make sure that you're really clear in being on the other side of that. So, what steps have you taken? Letting them know that really these things are not going to be affecting you in medical school. And so, those are slightly riskier topics. I think there's a way you can do them. Again, if you're talking about your action steps, what you've learned, and how you've sort of come out on the other side, and how you can take that with you. But I think there are some times that topics could be too personal. And so just be thinking about that. You don't have to make these, a confessional of your most personal thing. But really making sure you are showing the admissions committee that you are ready for medical school and to be really successful in medical school in your future career. Anything you want to add to that, Elena?
Yes, the only thing I wanted to add, sorry, I was trying to respond another one online.
Yeah, lots of
but I had
questions.
something important. The question was about what? Please remind me. Sorry. About the personal. Yes,
Too personal. Too
you remember.
personal.
Yes. So yes, I just had a quick comment about that, and that is write something that you will be comfortable talking about in the interview. So I've had students that shared about one of the relatives unfortunately dying, and then when they go to the interview and they ask them about that, they are not ready to talk about these things, right? So just make sure that, as you mentioned in the question, you have grown, you have solved the issue, you can very in a very calm way talk about that, and that is fine. And I think you also put that line, some people are much more open to talk about these personal issues, some people are not. So also listen to yourself.
All right. What else, Elena? Going through lots of questions.
Yes, that's what I was saying. So we're gonna
Oh,
try to answer as many as possible, but
yeah.
I was just gonna advertise that we have these sessions every week. Every Friday, probably next Friday, we're going to have one for general questions about the application. So that may be another place to go. You need to go to our website, training@nih.gov, and you can register and just attend if your question is not answered today. Yeah.
Yeah, great. So, question about, is it better to submit secondaries within the same day of receiving it, or would it be better to wait? I think when you're ready. I think we don't know exactly what the COVID question is going to look like. And so I would say, within a couple of days is going to be completely fine. You don't have to resubmit it that day. Making sure that it is of the best quality, right? So I never want you to sacrifice your quality just to get it in faster. Have someone who can read over them. Make sure if you are doing any cutting and pasting, like I said, it's better for you to really think about the question and to think about that school. But if you are doing any cutting and pasting, having someone look over it one more time to make sure the names are right, the locations are right, the programs are right, because that is going to hurt you if you don't take that extra step. And so one way to do that, right, if you really are ready to go, but it is to go ahead and start and then sleep on it for a night. Wait till the next day, really reread over the whole thing as a group, right, by school, and make sure that it really is what you want to say, and then submit it.
Great. We have another very good question here. So even if you do not have an MCAT score, is it still recommended to go ahead and apply to schools and send out secondary ASAP?
So the short answer is yes.
Yes.
The long answer is, because you don't have an MCAT score, you might not know exactly which schools you're going to apply to. And so there are pluses and minuses, but There are some places that you can look. There's a document on MSAR that's talking about, you know, the application process. There's some information there, but keep in mind this cycle is really different, but that there are limited numbers of interviews and limited numbers of spots. And so some schools are going to look at you even without the MCAT score. And so balancing all of these things, I know for those of you who haven't taken the MCAT, you're also really needing to balance your study schedule. And so think about what is going to be best for you. So one option that we give students is to go ahead and apply to one school or a couple of schools that you know you're going to apply to no matter what. So those could be your in-state schools. That could be really a dream school, a reach school. And then you can add additional schools later once you have your score. That's one option. We heard from the representative at The Ohio State University yesterday that they made sure their deadline is going to give you enough time after that last MCAT date to be verified and get their secondaries in. So all of their deadlines, they've pushed back a little bit to make sure that you don't have to apply without that score if you don't want to, if you decide that that school really isn't going to be a good fit for you.
Then just the last comment about that is that we also learned yesterday that they really want to see that you have a scheduled MCAT date, right? So they may consider you without the MCAT score as long as you are planning to take it and you have a scheduled date.
So there's a question about our future career. Should we talk about a practice setting we see ourselves in, such as academic medicine? On the flip side, if they specifically ask about practice setting, is it acceptable to also address our specialty of interest? So yes to all of those things. Keeping in mind that you could change your mind and they know that. And so in some cases, you know, you don't need to be so specific. Maybe you could think about your interests and how your experiences have aligned. But really being true to who you are and what you would like to do in the future. Anything you want to add to that one, Elena?
No, that will be all. I was trying to respond to the next question, but I think I speak faster than typing. So the question was for the diversity question, we should only talk about our experiences after high school then. So this person asked me before a question about what would be the best time to describe, to go back in terms of the experiences, and I said it was better after high school. However, thank you for making this extra question. For the diversity question, you can go back to this very young age. Of course you can. Just make sure that you describe some of your reflections you can include from that time, but hopefully you can also include from more recent times. And I was telling, writing in the answer box, where your brain is more mature, when this reflects better who you are now, right? So include both, and of course there are a lot of things that happened at a young age. Include it. That's fine.
Yes, absolutely. So does the screening process just mean schools are not selecting you due to MCAT GPA, or is it based more on primary application, essays, experience section, and how well you fit their school? I don't have all of the information for everyone. I don't know how in depth they are going to look at your application. For some schools, I would say, especially those who list some minimum requirements, it will be MCAT and GPA. But for some schools, they might be looking more specifically. So be aware of that. But for many, I would say you're going to be getting secondaries from most of your schools unless you don't meet their minimums. But there are lots of different filters that they could use. Oh, is the fair going to be virtual this year in light of COVID? Yes, absolutely, 100% virtual. We're going to have panel discussions. We're going to have videos. We're going to have representatives from schools throughout that week. But yes, it will all be virtual. All Are secondaries sent to students in the order they were verified, or should you expect if you're verified by July 10th, you should expect secondaries at the same rate as other students regardless? So that July 10th is the first transmission date that they see. And so I don't think if you submit it early in May versus in June, it's going to be really any different. But then moving forward, so let's say you get transmitted July the 10th. All of you are sort of going to be on equal playing fields. That's why they do it that way. But then moving forward, let's say you don't apply until July 23rd. It's going to take some more time depending on how they do that. And then you have the timeline of getting it back in. They have to review your application again. They have to invite you for an interview. So do your best to get in sooner. Realistically, how many essays? Sorry, go ahead, Elena.
Yeah, that one. Exactly, please. I think that's a very good question.
Yeah, realistically, how many essays can we copy, modify for all schools? For example, can we write one diversity essay and just modify it for all schools? So it's a great question. And so this is the balance, right? So I think the backbone of your essay could be the same. Again, if it's the same question, so some of these diversity questions are going to be written slightly differently, or they're going to want you to highlight specific things. But yeah, as you're pre-writing right now and thinking about really what makes you you, yes, you could definitely use some of those things. If there are things that you want to highlight about that and why you would be a good fit for that school, you might need to make some changes, or you might want to tell a slightly different story. And just be careful when you're cutting and pasting. Like I said, make sure you're going back and rereading it and that there aren't any things on there that are going to be any red flags if you're cutting and pasting. But yes, you can do some of that, definitely. We want you to be aware. And so what I tell my students, even for applying to college, right, take a look at all of your schools, take a look at all of your questions, go ahead and do that, and then really start working through them in a way that makes sense. But your last look should be that school by itself so that you're double checking everything on those secondaries. Oh, so there was a question about, oh, you answered this to all, okay, about emphasizing growth. Yeah, answered that one, okay. So if asked about your research in a secondary app, do you have tips for answering this question from a new perspective when you've already discussed it in the work and activities list and your personal statement and potentially the MD PhD essay? Yeah, so again, think about the specific question that they're asking from that perspective. And then think about giving specific examples. So in this case, I would say do no cutting and pasting from your primary at all, and really put the question at the top of a blank paper and think about the examples that you can give to answer that question and to really show what you did and what you learned and how you reflected from those experiences. They're gonna expect some overlap if they ask you this type of question, especially if you're an MD PhD candidate. But try to talk about it from a slightly different angle or about that school in particular. And so if this research question is couched at all in that why us type question, make sure you're talking about their research programs, their tracks that are going to be available to you and why you are applying to that school because of those opportunities. So being thoughtful about the research that you've done and the research that's available there. So this is even more important if you, are an MD PhD candidate, for them to be able to see that you have thoughtfully chosen that school for their research opportunities that are there. Would you recommend talking about various research experiences in the research essay or focusing on just one? Oh, Elena, you just answered that one. Great. Can you use, okay, so we talked about high school a little bit, so you can, but really they're going to be interested in college and beyond and what you have done to overcome those things and grow from those things. Are MD, PhD secondaries different from MD only secondaries? In some cases, yes. So some of the ones that I was looking at, depending on the type of program you're applying to, the secondary questions might be slightly different. So for schools who have, say, a primary care track, they might ask you a slightly different question than other candidates. So look on all of those individual websites to answer that question. Should the diversity essay focus more on what makes you diverse or times you've worked in a diverse environment when they ask you how you are diverse? So this is also a good question. I would say it's going to be a combination of both, because in those experiences you bring to the table who you are and your past experiences. And so again, you want to show to them your cultural competency and you're working with diverse persons, but look carefully at how they're asking that question, because some of these questions, they are very specific. But again, how you're going to be a good fit at that school. Why are you applying to that school? What programs do they offer? Do you know how applicants typically pace themselves in going through the secondaries? Should we avoid multiple revisions on essays? So this is really just going to be dependent on you and your timing and how you write and how you do things. So some students, right, just like to get words on paper. And so it's an initial very rough draft. And so it requires multiple revisions to really perfect it and make it of the best quality. Some students really are thinking about it first. They're outlining or taking notes. And so that first draft is of better quality. And so for this, it's really just going to depend on the number of schools to which you are applying. When you get them, what else do you have on your plate? And so you're just going to have to figure out what works well for you. Anything you want to add to that, Elena?
No, I think that is just complete. Perfect.
Okay, so
I am trying to answer some, yeah.
Yeah, so for the secondary research, so not all schools are going to have the secondary research essay, right? Some are, but if you already described the project as part of the work and activity section, the primary, should we repeat the methods, hypothesis, or just focus on reflecting? So if they ask you specifically to state the hypothesis and the methods, then you need to do that. When they're asking you those questions, they're expecting, again, some overlap. But in your work and activities section, we recommend you don't spend so much time on the methods necessarily and really what you learned and with the impact for patients, so diagnosis, prognosis, prevention, and treatment. And so your work and activities section could be a slightly different angle, but make sure you're really answering the question. They ask them slightly differently, again, to make sure that you're not doing as much cutting and pasting. And so make sure you're answering the question in each part of the question.
Sorry, just let me try to fix an issue, a mistake I just made. So I was trying to answer a question and I put it in a different question. So someone asked about sending, oh, you cannot see me. Sending, when are they exactly expecting secondaries if they haven't received the transcript? So I was trying to say that a few schools, really a very few number of schools, will send you secondaries without verification. So don't be surprised if one or two schools still send you the secondary application. For most of them, they will send it to you almost immediately after you are verified. So even if you submit it and if you haven't been verified because there was an issue with the transcript, then if you are not verified, you are not expecting to receive those. I would say as that is difficult to predict, especially now with the mail issues. Just try to, pre-write as much as possible, as many as possible, because all of a sudden you are going to receive all the secondaries eventually, right? So if you can pre-write that, that would be a recommendation.
some schools have some information on their website. And so for all of your schools, be following what they're saying about all of these questions, because some give more information than others about what their policies are. Yes, I will give you, I can put, sorry, really quick. Elena, do you want to answer just while
Yeah,
I put, I'm just going
sure.
to go
Yes, please. You
handout,
pause and then
right?
I can try to do a couple of them. So someone is asking, does this postback count as, and I guess this person is talking about the NIH, makes me unique? A lot of people have gap year experiences, but working in the government, in the world's largest hospital devoted solely to clinical research, worth it to mention? I would say absolutely, right? And this really needs to come from a real feeling. I think you have all the reasons to use this as a unique opportunity. We have people now working in Building 10. We have students working on the vaccine right now. What do you think? That I think that's pretty unique. So also talking about, the perspective, having the exposure at the NIH, being the NIH the kind of institution it is, I think you have enough reasons to use this as a unique experience.
Trying to
So
just, we have a couple more minutes. So I was just trying to glance through and
we
see
are
if
sending all the slides just for people asking about the slides.
I just put them up as a handout. That's what I was doing.
Okay, great.
So you should have them. Let me know if that didn't work. But I just put them up in the handouts.
Just remember, you need to go to the right menu. You have different tabs there. In the same place, when you have your questions tab, you have the handouts tab. Click on there. There is a symbol of a PDF file. That is the slides. Anyways, Victor Correa is going to send this to everyone today or tomorrow. So you have these two sources.
So a lot of people are asking about the number of secondaries. It really just depends on each of the schools. So just look, some have quite a few, but they're much shorter. Some that I was looking at, really a lot, they have what looks like a lot of questions, but there are a lot of check boxes, yes or no. And so it really just depends on the school.
Just let me clarify something, because I see some questions about, so nothing before college experiences can be used. No. Of course, you can use some information, some of your experiences, but try to go beyond that time and your reflections now and your conclusions. And hopefully, if that was a continuous experience, like a challenge, for example, of course, if that started in, early in your life, you need to mention that.
So some people again are asking about this timeline and the difference between 3 days and 2 weeks. And so schools do track this. They're going to be looking at, say, the average time that students submit, but the earlier you submit, the better. But again, I don't want you to sacrifice quality, and I don't want you to put the applications off that are the better fits for you, either numbers wise or in state. So no, I don't think there's a huge difference necessarily, but there could be subtle differences in showing your desire to attend that school. So something to be aware of.
Other question about hardships you encounter on the secondary. Is it taboo to repeat the information you wrote in the disadvantage statement from AMCAS? Want me to answer?
Sure.
So I think it's a good idea to try to give other examples. You are not gonna show yourself as a different person, but you don't want to repeat what you have there, right? So maybe this kind of the same theme, the same challenges, but you may want to expand on other examples here, so it doesn't look like identical to the disadvantage status.
So some people are asking where to find secondaries from last year. This is the one time we tell you to use Student Doctor Network. So we say limit your time always on Student Doctor Network. But many of the questions are listed there and elsewhere. I found some on Reddit, other places that you can find prior years. There are some schools that on their website, they list the last, say, 3 years of secondaries. And so you can take a look. A couple that I was looking at this morning, you know, the last 3 years, their secondaries haven't changed. And so presumably they're going to be asking you the same question again, maybe with a COVID question on top of that. But lots of different places that I think if you just Google the school name and secondary questions, they'll pop up. You'll be able to find them. Is there another one you want to answer, Elena? I see we have 5 minutes left.
Okay, you tell me what time. Okay, I was thinking about applying this cycle, but given the current situation, I was not able to acquire clinical experiences. Given how hospital settings, and I know this situation is kind of common now, so given how hospital settings are being careful and admitting less people, if any, how could I still get some experiences before next cycle, given the huge uncertainty? I know this is not directly related to this cycle and secondaries, but thank you for reading this message. Okay, sure, Hector. So we have been sharing, I don't remember exactly where. Oh, I think in the presentation I gave yesterday, ways to volunteer with the community virtually, mainly community service. I don't know if you said just clinical. Okay, so the community service are the non-clinical. The clinical are the tricky ones, right? Because at this moment, we don't want to recommend you to go out if we don't know your personal situation, if we don't know that you can be at risk and you can put others at risk, right? Because it's not only you. If you are living with family who can be at risk and you bring the virus home, that would be not a situation you want. So you really need to evaluate your situation and really see what is the kind of things you can do. We have seen a couple of situations where people use their creativity to learn from the clinical environment, especially those that are interpreting, right? So if you are bilingual and if you can offer your services as an interpreter, you can still hear, you can still see if this is telemedicine, how the doctors approach the patients, what is the dynamics there. You can learn a lot about the medical profession in that interpreting position. So that is one that you may still do remotely without putting yourself at risk. Other people who live by themselves, who whatever reason they decide that is safe, they are going to hospitals, to blood donation sites, to screen people in hospitals. Some people are at the clinical center volunteering, screening people. So you need to really be very careful when you evaluate your situation.
There's a question, how to approach the diversity question, adversity for LGBT applicants when LGBT are not considered historically underrepresented in medicine by the AMC. How would you approach these topics when the audience may find them uncomfortable? So first of all, let me just say that I'm sorry that these topics still are uncomfortable for some people, especially right now during Pride Month. And if any of you didn't have a chance, I know Dr. Sharon Milgram was doing a Twitter chat earlier, so I would encourage you to check that out. She's a really fantastic role model in the whole biomedical community surrounding these types of topics, and these are really important issues in healthcare, right? There are lots of topics, and so I wouldn't shy away from the topic just because it isn't historically underrepresented in medicine by AAMC. This is part of what makes you you and part of your diversity. And one of the things that Elena and I were talking about this morning is even if there's one person on the admissions committee who maybe is a little bit uncomfortable with the topics, be thinking about the environment at that school and if they're going to be welcoming to you and have you and what their programs are surrounding these issues. So I was looking actually at University of Maryland last night. They had a really nice workshop. And so they talked about, cultural competency and transgender issues and LGBTQ issues and how that impacts health. And so while you are doing your research, And while you are thinking about the schools, be aware of, you know, the broader impacts of this. And again, you know, I think we're making progress on these topics and in healthcare, but we do still have a long way to go. All right, it is 1:39. I promised Yewan we would finish on time. Do you have any last comments or last question, Elena?
No, I think that I'm sorry, we couldn't answer all the questions. And you know what? I think we answer a lot. So we may be able to screen this again. And I was putting a mark for those which were answered verbally. So we can try to put like an FAQ for you.
Yeah, absolutely. So thank you for coming and attending. And next week we will be continuing some Q&As. And so we'll be answering, general questions. The slides are up in the handout, so feel free to grab those. And we wish you really well. We wish you the best. Please reach out. Yeah, we hope that you'll be really, really successful this cycle and next cycle. So have a great day, be well, stay safe, take advantage of the small group discussions on wellness and resilience and application stress, and we'll be continuing those throughout the cycle too. So make sure you're reading your emails from Lori Conlin in the morning to find out what we have that we're offering for you all. Bye. Thank you.